and to thank her for her dedication to her family, community, and law enforcement.
The honourable member for Northside Westmount.
Mr. Speaker, after working their whole lives making important contributions to our province, seniors deserve a retirement that is both supported and dignified. That means residents of long-term care facilities should enjoy the simple pleasures of fresh fruit and vegetables, butter, and appetizing meals. Unfortunately, Mr. Speaker, a $3.4 million cut to nursing home budgets means that food budget for many of our seniors, is between $5 and $6 a day. Too often, it means a monotonous menu of bland food. Instead of blaming the situation on hard-working professionals at nursing homes, the Premier should stop putting the quality of the life of seniors in the crossfire and increase the food budget for our nursing homes. Mr. Speaker, this should not be a matter of dollars and cents for this government. It should be a matter of respect.
Order, please. Time allotted for member statements has expired. We'll now move on to oral questions put by members to ministers. The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is to the Premier. In each of the last 2 years, this government has cut the budgets of nursing homes, Mr. Speaker. At Northwood Halifax, that cut for this year alone is $423,000. The government was warned in writing, Mr. Speaker, that these cuts were unworkable, and I quote, "Unless we reduce building temperatures and lighting, have residents bathe less, or provide residents with less food or food of lower quality." And I'll table that letter from Northwood, Mr. Speaker, with that quote attached. So I'd like to ask the Premier, since he was warned about the devastating effects of these cuts, why did he go ahead and make such devastating cuts in our nursing homes?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. I had the good privilege of representing a number of those nursing homes in my constituency, in the constituency of Annapolis. Annapolis Road Nursing Home, which I visit quite often, Mr. Speaker, as well as the Heart of the Valley Nursing Home, as Mount Lee Lodge, which is in Bridgetown. I'm very fortunate to have so many caring individuals who care for our citizens, our parents, Mr. Speaker, our grandparents. As the honourable member would know, that issue was raised. I think he may even raised it during the election. We have a different point of view than the nursing home when it came. We believe that funding can be saved through administration. But, Mr. Speaker, in being fair, we've sent an auditor in. When we find out when we get that audit report, we'll respond to it, Mr. Speaker.
The Honourable Leader of the Official Opposition on his first supplementary.
Mr. Speaker, there are very caring staff in all of those nursing homes. The fact is they need a caring government that actually gives them the resources to deliver the services, Mr. Speaker. That is what's missing here today. Mr. Speaker, they can call in all the auditors they want. The fact is that this government, Mr. Speaker, cut nursing homes like Northwood and the ones that the Premier just mentioned and others all across the province. These cuts are cruel, they are heartless, Mr. Speaker, they are mean-spirited. And they were warned of the effect, Mr. Speaker. They don't need an auditor. They were warned of the effect, as Northwood wrote to the government itself. They said the expectation now is that we'll provide food for our residents at a cost of $5.12 a day, Mr. Speaker. No one should be expected to live on that. How can the Premier possibly justify ordering nursing homes like Northwood to feed our seniors, our parents and grandparents, on $5.12 a day?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. He's completely inaccurate, Mr. Speaker. What we've said to those nursing homes, Mr. Speaker, take the savings of administration and don't apply it to your profit line. Invest it on seniors in this province where the money was intended to be.
The Honourable Leader of the Official Opposition on his final supplementary.
Mr. Speaker, if the Premier had any idea what was going on in nursing homes, he'd know we're talking about non-profit nursing homes that operate on a shoestring, that are providing food to our parents, and the letter that I just tabled comes from one of them saying that his government requires them to serve seniors on $5.12 a day. Those aren't our numbers, those are Northwood's numbers, Mr. Speaker. It's about time this government actually looked at the devastating effects of their actions, Mr. Speaker, and now that they know, now that they were warned in writing, now that they've been told that the effect of their action is $5 a day on food, will the Premier do the right thing and reverse those cuts, yes or no?
The Honourable Premier.
Mr. Speaker, the honourable member would know the nursing home he's actually talking about also has a for-profit line, Mr. Speaker. We want to make sure that the investment we're making that's going to seniors is being spent on seniors, Mr. Speaker, being directed to the very people who we've given the money for, Mr. Speaker, not to be hived off into investment, Mr. Speaker. And we're more than prepared to look and send an auditor in to work with that company to ensure that the investment this government is making is going directly to where it's supposed to be, to seniors.
The Honourable Leader in the House for the New Democratic Party.
Mr. Speaker, my question too is for the Premier. Mr. Speaker, for the past 2 days, the provincial health ministers have been meeting with the federal minister to try to come up with an agreement about health transfers. In August 2015, the Premier said he was opposed to the federal government distributing health funding based on population without taking aging demographics into account. In February of this year, the Premier said it would be difficult for any government to make changes to a funding formula, and I'll table these documents. Mr. Speaker, my question is to the Premier. Is he asking the federal government to change the funding formula to take into account Nova Scotia aging population?
The Honourable Premier.
I want to thank the Honourable for the question. As you know, as the Minister of Health and his colleagues from all across Canada were meeting over the last number of days, all Canadian provinces continue to stay united around the fact that we believe the increase in healthcare funding should be at 6%. The Minister has been very clear that aging populations like Atlantic Canada needs to have some reflection in that and the investments that the national government is making. We're continuing to work with the national government to make sure that we have a sustainable long-term funding model for healthcare that will allow us to deliver healthcare to our citizens.
The Honourable Leader in the House for the New Democratic Party.
Thank you. Mr. Speaker, as the meeting in Toronto started, the federal minister said when she goes to her financial minister to ask for more money, she needs to be able to tell them that the money will be used for health. A report by the Nova Scotia Auditor General found that our own Department of Health and Wellness underspent their budget by more than $31 million, and I have tabled them documents, Mr. Speaker. Mr. Speaker, my question, how can this Premier argue that he needs more money from the federal government when his own government has underspent the health care budget?
The Honourable Premier.
Speaker, I want to thank the Honourable Member for the question. He should know, Mr. Speaker, the fact that we spend more money on health care than we actually receive from the federal government. We continue to invest along with our partners, Mr. Speaker. When he was in government, he made a decision. His decision was to pay out unsustainable wage increases across the public sector, Mr. Speaker. We've reduced the wait times for long-term care.
The Honourable Leader in the House for the New Democratic Party on his final supplementary.
Well, thank you very much, Mr. Speaker. But what is clear, this government's campaign on a promise for a doctor for every Nova Scotian, and yet there are 90,000, and I'll repeat that, 90,000 people in this province without access to a family physician. But somehow the budget for the physician services was cut by $500,000 this year. So, Mr. Speaker, if this government can't deliver on their promises for Nova Scotians, what assurances can this Premier give that he will be able to give a fair deal for the health funding for this province of Nova Scotia?
The Honourable Premier.
Mr. Speaker, I want to thank the Honourable Member for the question. I'm very proud to stand with the Minister of Health, the Nurses Union, to announce more nurse practitioners, family practice nurses. We're providing 14,000 Nova Scotians, Mr. Speaker, access to a primary care team with a doctor, a nurse practitioner, dietitian. Those are all positive signs. There's an announcement coming and may be made today. If not, it will be made shortly, Mr. Speaker, with a new doctor accepting 1,000 patients. Looking forward to that. We have a locum service in Digby, which is allowing more access to family physicians. Do we have more work to do? Of course we do, Mr. Speaker, but we're going to continue to work with our healthcare providers to make sure that we maximize the full scope of practice so that Nova Scotians who require healthcare in this province actually receive it from the appropriate healthcare delivery.
The Honourable House Leader for the Official Opposition.
Thank you very much, Mr. Speaker. My question, too, is to the Minister. You know, as are the Premier, as the federal Liberals are set to cut $60 billion in healthcare spending over the next 10 years, we learned something very interesting. Federal Liberal minister feels that there is a lack of accountability from the provinces where the health transfers are not being spent totally on health care for Canadians. What we've learned from this exchange is that Nova Scotia is one of the ones they're suspicious of. Mr. Speaker, we received an extra $46 million in transfers. And we all know that this year that the Liberals cut $5.5 million of the health budget, not including the underspending of over $30 million. So my question to the Premier is simply this. What'd you do with the money?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. As he should know, as the Minister of Health, quite frankly, the national government is talking about actually reducing the escalator, Mr. Speaker, not actually cutting funding. What they're saying is that the increase would be at 3%, not 6%. We completely disagree with that. Mr. Speaker, we're prepared to work with the national government to target funding on the needs of Nova Scotians. Example like home care, we believe in that. A national pharma care program, we're not opposed to targeting, Mr. Speaker, because what's happening and what the Prime Minister is highlighting under Conservative and New Democratic governments in this province, Mr. Speaker, they funded money into this province, which has never got the programming, Mr. Speaker, or never got to where it was intended in reducing wait times. They used it to spend somewhere else. So I would ask the former Minister of Health to go back to when he was Minister of Health and explain what he did with the cash. We know what we're doing, investing in home care, reducing long-term care wait lists, Mr. Speaker, continuing to continuing to provide health care professionals, continuing to reduce the number of people to access primary care. Those are all positive signs, Mr. Speaker.
The Honourable House Leader for the official opposition.
Well, Mr. Speaker, what you really need to ask, or the Premier should ask, is maybe the previous minister, the last Minister of Health in the PC government, oh, wait a minute, she's a Liberal over here with the Liberals now. Ask her. She should know. Mr. Speaker, $51 million that Premier had something to do with. Wait times are getting worse. Long-term care is in chaos. People don't have doctors. And you're saying that you don't have a way to spend that money?
Order, please. I'd like to remind the honourable member for Argyle-Barrington not to refer to members opposite directly. The honourable member for Argyle-Barrington.
Mr. Speaker, people are without doctors. You know, even the people of Barrington who've been asking for a dialysis unit has been told that there's not enough money for them. I think this government has lost its credibility in taking care of Nova Scotians. Yesterday, I thought the federal Liberals were at fault, but now I can see that creative accounting that this Liberal government is at fault. When will the Premier do the right thing and make health care a priority and put the $50 million back where it belongs?
The Honourable Premier.
First of all, Mr. Speaker, I want to acknowledge the comments by the House Leader of the Conservative Party towards our Minister of Education. I want to make it clear to him. She only had 5 months to clean up his mess, and any reasonable person would know it would take more than 5 months to do that, Mr. Speaker. We're going to continue to work with our national government to ensure that we continue to invest, Mr. Speaker, continue to invest in...
Order, please. The Honourable Premier has the floor.
Thank you, Mr. Speaker. We're going to continue to work with the national government, Mr. Speaker, to ensure the appropriate funding model and sustainable fund care is in place. So we'll continue to make sure wherever you live in this province you access primary health care. Very excited about the health care professionals across this province who are willing to partner and work together for the first time in a long time. All of them know that collaborative care is the way to go, and we're looking forward to make sure that we continue to build on the great work that has already happened, and we're going to continue to make sure that every community has access to primary health care.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. 10 months ago, the National Truth and Reconciliation Commission released its final report. It's also been 10 months since the Premier, who is Minister of Aboriginal Affairs, made a commitment to answer the Commission's call to action. So since then, we've heard next to nothing about what this government is doing to address the report's recommendations. In fact, unlike Manitoba and Saskatchewan, Nova Scotia's Aboriginal Affairs website does not even have a dedicated web page outlining this government's forthcoming actions to realize reconciliation in this province. So my question for the Premier is, when can Indigenous Nova Scotians expect to hear a tangible plan from this government on the TRC?
The Honourable Premier.
I want to thank the honourable member for the question, Mr. Speaker. On Truth and Reconciliation is important, Mr. Speaker, for all Canadians. We've continued to work. I've continued to work not only with my Aboriginal counterparts across the country, but I've worked with premiers across the country as well as the national leadership of the Aboriginal community. Continue to make sure that we implement those recommendations across not only Nova Scotia but indeed across Canada.
The Honourable Member for Truro, Bible Hill, Millbrook, Salmon River.
Thank you, Mr. Speaker. Well, I know a number of Indigenous people in Nova Scotia feel they have not been consulted deeply and meaningfully. The federal government has announced its intention to initiate a national inquiry into missing and murdered Indigenous women. This requires a buy-in from all of the provinces in order to be meaningful. But once again, this government has not been transparent about Nova Scotia's role in the forthcoming national inquiry. Our NDP caucus filed access to information requests to find out out. But everything we've received was redacted beyond clarity. I will table that. So I ask the Premier, can he please tell us how his government intends to participate in the national inquiry into murdered and missing Indigenous women, and why is this such a big secret?
The Honourable Premier.
Mr. Speaker, it's not a big secret. All she had to do was ask. Mr. Speaker, we have, as a government, both in opposition on this side, have continued to support. We had unanimous consent in this House by all parties, I want to say, one of the few legislatures in all of Canada to support the inquiry into murder and missing Aboriginal women. Mr. Speaker, when we had the request from the national government, we said we were a willing partner in the beginning, and we're a willing partner now. We'll do whatever is required to ensure that this inquiry is in the right way, to ensure that these communities, these families get Mr. Speaker, the support and, quite frankly, the understanding that they need.
The Honourable Leader of the Official Opposition.
Mr. Speaker, my question is for the Premier. For 2 years in a row, Mr. Speaker, the government has cut the budgets for our nursing homes. Now they are feeding seniors on $5.12 a day. We tabled evidence of that effect just a few moments ago. Mr. Speaker, the nursing home operators themselves are saying it's impossible to provide a proper meal to their residents, to our parents and grandparents, on that budget, Mr. Speaker. The Premier can say that it has to all come out of administration, but the fact of the matter is it's not, and he knows it, and we have the evidence here before this House, Mr. Speaker. So how can the Premier possibly tell Nova Scotians that frontline care isn't affected when we have evidence that our seniors are eating on $5.12 a day?
The Honourable Premier.
Speaker, again, I want to thank the honourable member for the question. Again, it's not accurate across this province, Mr. Speaker. We have heard from some nursing homes, Mr. Speaker, on a whole host of issues. The minister has gone in. We've gone in to look at. There's been a difference of opinion, Mr. Speaker. But at the end of the day, we believe the commitments that we've made and the funding that we put in place can provide the quality long-term care that our seniors and our families expect, Mr. Speaker.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, the Premier can believe it's not accurate if he wants. But tell that to Trudy Helmke. Mr. Speaker, I'll table her comments. She's a resident at Northwood. Mr. Speaker, she's seen a real decline in the quality of food there in the last 2 years. She calls the food now bland. She's identified the potatoes that they're eating to be powdered potatoes, Mr. Speaker. I don't know if you remember them. I remember them when I was a kid. They're terrible. Our seniors deserve better. Trudy Helmke is not making that up, Mr. Speaker. She's living it every day. Bob Enos is another senior at Northwood. He has spoken up to point out that his grandson has to bring him butter because they're not real butter anymore, Mr. Speaker. This is the reality that we're facing. I don't know how the Premier can say otherwise. Does he truly believe that people like Trudy Helmke and Bob Enos are just making it up when they report that the food quality has gone down at their nursing home in the last 2 years?
The Honourable Premier.
No, Mr. Speaker, but I believe the leader of the Conservative Party could be. So, Mr. Speaker, we've done the appropriate thing. We've sent an independent person into the nursing home to deal with the exact issues that he's raised and to deal with other issues, Mr. Speaker, when it comes out. If, Mr. Speaker, we're wrong, we'll respond to that. And any time, Mr. Speaker, when I've been wrong, I've acknowledged that and moved on and done the appropriate thing. We believe we've funded this nursing home to the tune it should be, Mr. Speaker, and we'll continue to do so. If it deems, as we've gone in to look at it, that there's an issue, we'll make sure it's looked after.
The Honourable Leader of the Official Opposition.
Well, I'm glad to hear that, Mr. Speaker, because the fact of the matter is the Premier is wrong on this one, and he was warned, and he was warned in writing. Mr. Speaker, Michael Walsh, the president of the Continuing Care Association, he wrote to the Premier recently, and I have that letter, and I'll table it for the House. And he said, while the provincial government has been telling the public that these cuts will not affect frontline care or the jobs of healthcare workers, service providers are being left with few options to mitigate the losses and maintain operations at acceptable levels, Mr. Speaker, but the cuts are still going ahead. Mr. Speaker, the Premier either doesn't get it or he doesn't care. Why is he allowing these devastating cuts to go ahead when he's been told in writing the effect it's having on our seniors?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. Again, I want to say to him, we've worked with providers across this province. I've been in many of these nursing homes. Contrary to what he believes, there's top quality care, Mr. Speaker. The men and women who are out working every day provide quality care to our citizens, and I'm going to continue to stand by those hard-working Nova Scotians who are looking after our seniors, and we're going to continue to work with them. If there are issues, Mr. Speaker, we'll work our way through them in individual places. As I said to the honourable member, we've gone into a nursing home. The very issues that were raised during the by-election, Mr. Speaker, we said we'll come in and send someone in, an independent person, to have a look.
The Honourable Leader of the Official Opposition.
Mr. Speaker, the Premier can stand by his talking points. He can stand by his auditors all he likes. We'll stand by the Trudy Humkeys and the Bob Enuses and all of those seniors, our parents and grandparents, who every day are being asked to eat on $5.12 a day. Mr. Speaker, the Premier has been warned. He has been warned in writing, and he just doesn't get it. Just like the film industry, which they messed up. Just like pharmacare, which they messed up, Mr. Speaker. Now we have our nursing homes and seniors eating on $5 a day, writing to the Premier, telling him the effect, and he still won't turn it around, Mr. Speaker. And he was warned in writing, as I said a moment ago, by the Continuing Care Association, who said it's not feasible to feed our clients unless, Mr. Speaker, it will result in the public losing faith in our healthcare system. Well, ask the Premier.
Order, please. Order, please. The time allotted for the member's question has expired. We'll move on to the next question. The Honourable House Leader for the New Democratic Party.
The Premier's answer didn't expire, but anyways, I'm sure we'll come back to that. Yeah. Mr. Speaker, the President of Doctors Nova Scotia recently wrote an opinion piece expressing her frustration with this government's handling of the health file. While she called the Premier's announcement of funding for nurses and nurse practitioners to join collaborative care teams as a positive step, she said the announcement was incomplete, Mr. Speaker. I'm beginning to think that this is because the government's plan for health care is definitely incomplete. Mr. Speaker, my question for the Minister of Health is how have doctors been included in discussions about the plans for collaborative care teams across this province?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I'm pleased to be able to report to the member's question and to all members and Nova Scotians that, yes, we went through a challenging year in terms of working out the master agreement. Since that has been concluded, doctors have had tremendous input into the primary care report that it'll be coming to be in December. We know that they have to champion not just collaborative care development across the province. They have, in fact, to be the leaders in working towards the best primary care that can be delivered.
The Honourable House Leader for the New Democratic Party.
Mr. Speaker, it's been more than a challenging year. It's been a challenging 3 years in our healthcare system. And I don't know which doctors the Minister is speaking with, Mr. Speaker, but I can tell you I've been contacted by many of them who do not feel this government is engaging with them on these changes. A letter from the Canadian Association of Community Health Centres points out that Nova Scotia has 88% of existing community health centres report significant operational pressures, and no Nova Scotia Community Health Centre receives core operational funding in the province. Over the summer, there was 2 collaborative practices in the North End, for example, Mr. Speaker, struggling to make government funding work. The subsidized rent deal negotiated with North End Community Health Clinic addressed their points for a moment, but I'm not sure about the Duffus Medical Centre. So I'd like to ask the Minister, does the government have a priority or provincial strategy for supporting collaborative practices, or are they just issues being dealt with on an ad hoc basis?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. What I can say is, having personally visited 10 of our collaborative practices across the province, all of those sites, whether it's in Bridgewater, whether it's Middleton, wherever these communities that have moved in that direction, they are all pleased with the arrangement that has been made with them in terms of the lease arrangement, the common space, the non-doctor providers, nurses, family practice nurses. Those arrangements have all gone very, very well. And what I can tell the member opposite is that I too have been meeting with doctors, and what I can tell the member opposite, yes, they raise a few concerns, but they're bringing solutions to the table as well.
The Honourable Member for Dartmouth East.
Thank you, Mr. Speaker. My question is for the Minister of Service Nova Scotia. According to the 211 website, the Minister's Department provides 95% of the funding for the service here in Nova Scotia. And the service website says, quote, the service helps Nova Scotians by reducing frustration of trying to find the right community or social service. Unfortunately, if you call in the evenings or weekends, the service is staffed not in Nova Scotia, but in Ontario. And the result is often incomplete or inaccurate information, or information which only pertains to Ontario. And as an example, last night a resident called and they were told the service was in Ontario and they should call their MLA. When asked who the MLA was, they were directed the wrong place. So, Mr. Speaker, why is a service intended to provide service to Nova Scotians being staffed by Ontario agents?
The Honourable Minister of Service, Nova Scotia.
Thank you, Mr. Speaker, and I appreciate the question from my colleague. I'd certainly like to learn more about the concerns brought to the attention of my colleague. If he's prepared to share those circumstances, I'm more than prepared to look into them for him.
The Honourable Member for Dartmouth East.
Well, Mr. Speaker, I'm certainly happy to provide the details, and it's not the only one. And this is not just about government funding jobs in another province. It's about inaccurate information. Over the past 3 months, I've experienced people directed to my office saying they were told by 211 they live in Dartmouth East when they did not. Of course, we still help them. We've encountered quite a few cases where after-all calls are resulting in blatantly incorrect information about programs in this province or information directing them to programs only offered in Ontario. So, Mr. Speaker, what is the Minister going to do to ensure that calls are answered in Nova Scotia and, most important, that accurate information is provided after hours when the problem seems to exist?
The Honourable Minister of Service, Nova Scotia.
Thank you, Mr. Speaker. Mr. Speaker, I find it hard to believe that this member has had this information for 3 months and only now chooses to bring it forward. I'm more than prepared to work with the member. To find efficiencies and find better services through the 211 program for all Nova Scotians.
The Honourable Leader of the Official Opposition.
Thank you, Mr. Speaker. My question is for the Premier. Mr. Speaker, seniors in our nursing homes, they are eating powdered potatoes in the last 2 years, Mr. Speaker, because they don't have the money to get real potatoes. They're eating canned vegetables because the government has cut the budget. They can't afford fresh vegetables anymore, Mr. Speaker. As the president of the Continuing Care Association says, it's not feasible, Mr. Speaker, to feed our clients on less. The residents, he says, are our #1 priority. Will the Premier make the residents his #1 priority and restore the cruel cuts that his government has made to our nursing homes?
The Honourable Premier.
Mr. Speaker, I want to thank the honourable member for the question. Of course, seniors are our #1 priority.
The Honourable Leader of the Official Opposition.
Well, Mr. Speaker, no one's buying that, not after pharmacare, not after they tried to double their premiums, Mr. Speaker, not after the cuts they've made to our nursing homes, Mr. Speaker. Money might be their #1 priority, but the health and welfare and the medicines of our seniors, that's the last priority of this government, Mr. Speaker. In fact, the Premier's whole defence this afternoon seems to be we'll cut first and we'll ask questions and the auditors later. Well, Mr. Speaker, put seniors first. That's what Trudy Humpke and the seniors at Northwood are saying. Put seniors first. That's what we are saying, Mr. Speaker. It's a simple yes or no question. Will the Premier actually put that money back into the food budgets or not?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question. As you know, we continue to work with organizations across our province, with whether not-for-profit or profit, Mr. Speaker, to continue to make sure we deliver services to our seniors across our community. Every member of this House had an opportunity, I'm sure, represents a nursing home in their respective communities. I encourage them to go out and get in, talk to the people that work in there, talk to the residents, Mr. Speaker. When there's issues raised, bring them and we'll deal with them as we continue to do. And I want to remind the honourable member that there are 40% of the seniors in this province, Mr. Speaker, have reduced costs of pharmacare. Mr. Speaker, thank you for the good work of the Minister of Health.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. Mr. Speaker, my question is to the Minister of Health and Wellness. People from one end of the province to the other have been trying to show the government that there are simply not enough family doctors to go around. In order to be admitted to a long-term care facility, the senior must have a family doctor. In many cases, the staff at the facility will have to make a special ask of a local doctor to take them on as a patient. This puts the physicians in a terrible position, knowing that senior may not find a safe place to live if they do not stretch their patient load. So my question to the Minister is, what does the Minister propose in cases where a senior does not have access to a family physician and ends up in hospital?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And I'm pleased to give the member opposite the most recent update in terms of recruitment. Today, the health authorities announced that a new doctor in North Sydney will be taking on 1,000 new patients. North Sydney, Sydney Mines, Florence, Gweedore, and Georges River. So there's a good chance that that senior will be getting a doctor.
The Honourable Member for Northside Westmount.
Thank you, Mr. Speaker. I guess another question I'd have, but I'll expect the answer later, is how many patients did the doctor in Gweedore have that was forced to give up his family practice? Mr. Speaker, the Liberals promised a doctor for every Nova Scotian in the last election, and have fallen short by nearly 100,000 people. 10,000 people in Cape Breton alone. As the population ages, so do many family physicians. All of these factors must amount to a huge amount of stress for our Nova Scotians. This is the last concern a senior and their family should have when they've reached the point where they require 24-hour care. So my question to the Minister, will he present his plan to remedy this situation, and how will he assist the long-term care facilities and seniors in the meantime?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. I thank the member opposite for bringing that question to the floor. We all know that primary care is of the utmost importance. Sometimes when you go and meet with your colleagues from across the country, they sometimes point out to you that you have a number of very, very good initiatives. And since July the 1st, we have added 21 new family doctors, 18
Order,
specialists.
please. The Honourable Minister of Health has the floor. Order, please. Order, please. The Honourable Minister of Health has the floor.
And look, I won't be happy until all Nova Scotians have a primary caregiver, but what I'm pleased to say that at the present time, we have the third highest number of patients being seen by doctors and primary care providers in the country.
The Honourable Member for Dartmouth South.
Okay, thank you. Mr. Speaker, my question is for the Minister of Justice. Many questions were raised about security procedures for inmates in hospitals when a woman was recently shackled in her hospital bed while recovering from surgery. The Minister herself said it sounded like we'd gone a little too far, while the Minister of Health said it seemed like a 19th century practice, and I'll table that. Mr. Speaker, aside from being highly degrading, shackling this woman could have jeopardized her recovery. So I asked the Minister, if this woman was a low-flight risk and other security measures were in place, there were 2 guards in the room 24/7, why was she shackled to the hospital bed in the first place?
The Honourable Minister of Justice.
Thank you very much, Mr. Speaker, and I'm really glad that the member opposite has raised this issue. Certainly this had come to my attention as a result of that particular woman who was in custody being shackled in a hospital, and as she has said, the quotes from both the Minister of Health and from myself indicated that we were not satisfied that that was the right response. We asked for it to be reviewed and the shackles were removed, but as a matter of principle, the first concern is always the health of the individual, and corrections will always work with the health providers to ensure that health is not impacted.
The Honourable Member for Dartmouth South.
Mr. Speaker, this case has raised broader concerns about security procedures in place for when female inmates access health services. For example, Mr. Speaker, as I understand it, female inmates who wish to access prenatal care must do so in handcuffs. This is a policy that needs to be reviewed as well. So I'd like to ask the Minister, will the review taking place be looking more broadly at security procedures relating to inmates accessing health care services such as prenatal care?
The Honourable Minister of Justice.
Thank you very much again for that follow-up question. And certainly whenever any of our offenders are outside of the institution or being escorted somewhere, they need to do a risk assessment each time. And I think that will remain the case, but we want to make sure that we have a proportional response, that it is the correct response whenever you look at what is the flight risk or what is the danger that might be posed by that individual. And I think that we need to take a cautious approach, but also a very compassionate approach in doing that. that. So that will be what we'll be looking for in the review.
The honourable member for Kings North.
Mr. Speaker, my question is for the Minister of Health and Wellness. Mr. Speaker, the budget cuts to long-term care facilities have had a very real and visible effect on seniors' care. Many facilities do not have the resources to provide all the services and goods they need for residents. Adding to the difficulty, the Minister announced funding cuts to the facilities well after they had finalized their budgets for the year. They had to go back and make cuts retroactively. Rate changes for individuals living in long-term care facilities are released November 1st each year. It is only fair that any changes made to funding plans be made public at the same time. My question for the Minister is this. Will the Minister finally realize how short-sighted these cuts are and ensure they do not repeat this haphazard approach to funding?
The Honourable Minister of Health.
Thank you, Mr. Speaker, and pleased to respond to member for King South and his concern about homes. Possibly he's speaking universally, but perhaps the ones he's familiar with, like myself, Indianapolis Valley. And what I can say is that I've been into several during continuing care month to talk over both their short and long-term concerns that they have, and I think the member opposite as well knows that Indianapolis Valley, we have a number of first-class nursing homes. The care is outstanding, and they've made some changes with administrative deficiencies. Finally, working together for bulk purchasing, a number of homes going to the same insurance provider. They've met the challenge, and we'll certainly be supporting them going forward.
The honourable member for Kings North.
Mr. Speaker, each year that the government has made cuts to senior care and long-term facilities, they have at the same time been asking service providers to deliver more. This simply does not make sense. Operating costs have gone up significantly, and the government is downloading more and more responsibilities onto facilities. These organizations are underfunded and doing their very best to provide care to seniors who've contributed to this province their entire life. My question, Mr. Speaker, for the Minister is, will the Minister commit that any additional programming requirements are matched with additional funding for long-term care facilities?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. And it was important that homes start to work together, realize a whole number of efficiencies, and really what the cut certainly brought forward. Nursing homes that, in fact, have been running some who have been running a deficit for a decade. We're going to work with them especially so that all nursing homes can operate in the province without a deficit, and that we will work towards improving those areas that need some help. Look, I'm pleased when I go into a nursing home like St. Vincent Nursing Home here in the city, where 40% of their diet is locally procured Nova Scotia grown produce.
The honourable member for Pictou Centre.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Minister of Health and Wellness. Mr. Speaker, Alexander McMillan is a victim of Nova Scotia's healthcare crisis. Mr. McMillan has no family doctor and lives with daily pain. He is frustrated and angry. He is forced to rely on walk-in clinics or the emergency room to provide help when his suffering becomes unbearable. Because he has no family doctor, temporary pain management is all he can hope for, not treatment for the cause of his unbearable pain. My question to the Minister, will the Minister admit that his inability to deliver on the Liberal election promise is victimizing people like Alexander McMillan?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I don't think it's any secret that I need to keep from the member. He's probably heard that new collaborative practice will be coming to Pictou. We're doing all we can to meet the primary care needs in that community, and at times there can be a gap. There was a death of a doctor in that community last year. Another one retired with, again, very little notice. We're working to now have doctors give a longer-term picture of what their practice will be in terms of number of patients when they're winding down their towards retirement. That will give us a better picture to recruit, as well as we have since July 1st of this year.
The honourable member for Pictou Centre.
Mr. Speaker, Alexander McMillan has been without a doctor since February. His son, Zachary, stated that having no family doctor has devastated their family. He stated his dad's quality of life has been destroyed and has financially ruined him. My question to the minister, how long will people like Alexander McMillan have to suffer before the minister takes action to fix the doctor shortages in Pictou County?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. We know that there is the provision for a patient to certainly go to their ER if there is an issue that they are of concern to them. And I know that when anybody loses their family doctor, it's a difficult time. Where the health authority is working to make sure that all the residents of Pictou County will have a primary care provider, and good progress has been made with 21 family doctors coming to the province just since July 1st of this year.
The honourable member for Halifax Needham.
Mr. Speaker, my question is for the Minister of Immigration. Language training, employment services, and family counselling will always be needed in order to retain new immigrants to our province and give them a proper welcome. Most of these services are provided by organizations like ISANS and the YMCA, whose staff are forced to reapply for the same provincial funding every year. This creates an unnecessary administrative burden for those working at the front lines of settlement services. Will this government consider moving to multi-year funding agreements with the handful of organizations assisting immigrants here in Nova Scotia?
The Honourable Minister of Immigration.
Thank you very much, Mr. Speaker, and thank you for that question. I know firsthand how not easy it is to settle in a new place. And that's why the Nova Scotia Office of Immigration is investing more in immigrant settlement services across this province. This year, we've increased our settlement funding to $6 million for those services. The federal government does a yearly call for proposals, and for the province to issue a call for settlement services each year aligns our funding with the federal government's yearly proposal as well. Thank you.
The honourable member for Halifax Needham.
Mr. Speaker, long-term funding agreements would save the province and the service providers both time and money. Providers would have fewer applications to file, and this government would have fewer applications to process. More of our public investments in the provincial immigration system would reach newcomers. Why does this government continue to make harmful cuts in other departments when there are clear opportunities like this to save money and improve efficiency?
The Honourable Minister of Immigration.
Thank you very much, Mr. Speaker. As I said, immigration settlement funding has increased to $6 million this year from $5.4 million in 2013. We keep investing more in those settlement services. We value very much the settlement partners that we're working with. Currently this year we're working with 14 of them. So not only will yearly funding for the moment allow us to align our funding with the federal government, but it also priorities change, and I can give you the extreme example that we had this year of the refugees that came within the last 12 months. Had we done multi-year funding, we would have never been able to align our services and forecast for that. So the yearly funding at the moment works very well for us. Thank you.
The honourable member for Sydney River, Myra Lewisburg.
Mr. Speaker, my question to you is for the Minister of Health. Mr. Speaker, Claire and Florence Wadden are two individuals who are in their senior years, married over 50 years. They had health problems. Florence landed in a home. Claire made a decision to go into an assisted living home and made arrangements to have Claire move there. He offered to take her by car. He was refused that. He asked if he could take her by taxi. and then was refused that. So at the end of the day, he was told the only way that they could transfer her from one unit to another was by an ambulance. Mr. Speaker, the question to the minister is, does the minister believe that a $500 charge to move a patient at a nursing home from one facility to another health facility is a reasonable charge that can be made?
The Honourable Minister of Health.
Thank you very much, Mr. Speaker, and I thank the member for bringing that case here to the floor of the legislature. And after today's session, I'll work with him to get more details, and I think we can get a result to this very quickly.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker, and I want to thank the minister for that. I just think it's important that people understand that if you stood on this doorstep of one of these nursing homes, you can see the other nursing home. As a good matter of fact, I could even walk there if I had to. Mr. Speaker, a $500 charge to move somebody less than 500 yards is like a unreasonable, unrealistic, unprecedented cause and factor for seniors in this province. So, Mr. Speaker, I look forward to making sure that the minister not only address this for Mr. and Mrs. Wadden, but for all Nova Scotians that find themselves in that same predicament.
The Honourable Minister of Health.
Thank you very much, Mr. Speaker. You know, these situations come along and they do highlight that there can be inadequacies within protocols that have been part sometimes of our old health districts, and sometimes the operator had certain protocols. But I believe there can in fact be a number of safe ways in which we can look after transportation needs.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you very much, Mr. Speaker. And Mr. Speaker, my question through you is for the Minister of Natural Resources. Mr. Speaker, there's been a fair amount of investments being made into provincial parks over the last little while, and that's a good thing, and nobody would dispute that. However, we have a park on the Myra River called the Myra Provincial Park, and it is upgraded. It's a very good facility. It has been upgraded for a number of years now. But the question is the length of the season. Those that are there and use that facility say that the season is too short. Other facilities on Cape Breton Island have been kept open because of the Celtic Colours Festival. I would wonder if the minister could address the situation regarding the period of time that this park is opened.
The Honourable Minister of Natural Resources.
Thank you very much, Mr. Speaker, and I thank the member for the excellent question. I have to agree with him that the Myra Park is one of our most beautiful parks that we have in the province, and Nova Scotians in this year have demonstrated the love that they have for the parks, because in the province the early indications are that our occupancy at our parks is up over 20%. And that's a very, very good thing. I think that increase, Mr. Speaker, is probably assisted by the Grade 4 program that we put in place, the efforts that we made to make it more welcoming for our veterans, and the excellent staff that we have at our parks. Thank you very much.
The Honourable Member for Sydney River Myra Lewisburg.
Thank you, Mr. Speaker, and I can say that the staff at this park and all of our parks are highly exceptional individuals, but what we need is an increased season to help with the tourist season that we have, to help with the people that come to Cape Breton to visit Celtic Colours. So I hope the minister will review the situation and look at extending the park's opening times by at least a month, shouldered on both ends.
The Honourable Minister of Natural Resources.
Thank you very much, Mr. Speaker. And, you know, in view of the overwhelming outpouring that we've had this year for our parks across the province, in a dynamic organization, we're always looking at what we need to do, how we can better serve the public, and we certainly are going to take that into consideration, Mr. Speaker.
The Honourable Member for Chester St. Margaret's.
Thank you, Mr. Speaker. My question is for the Minister of Environment. The push to develop tidal energy in the Bay of Fundy has hit a major roadblock, with a group of Nova Scotia fishers seeking a court order to suspend the minister's approval of the Cape Sharp Tidal project until a judge can review the case next year. A spokesperson for the fishers has said they are still holding talks with Cape Sharp, but there has been no word on talks with the minister or anyone else in government. So, Mr. Speaker, I'd like to ask the minister if she or anyone else in government is currently in talks with these fishers.
The Honourable Minister of the Environment.
Thank you so much, and I'd like to thank the member opposite for that very thoughtful question again. The Bay of Fundy, as we all know, is recognized as a Nova Scotia treasure, and it's a wonderful asset for all of us to enjoy and share with the world. And anyways, the Nova Scotia Environment's role was to assess the environmental effects monitoring plan for the Cape Sharp project. So we are satisfied that the proposed monitoring plan, together with monitoring and study enhancements, will help improve the understanding of the interaction between the turbines and marine life. That said, I have met with the fishermen in the past and listened to their concerns, and I don't believe I've had any requests to hear from them.
The Honourable Member for Chester St. Margaret's.
Thank you, Mr. Speaker. Mr. Speaker, many Nova Scotians are excited about the potential of tidal energy, but I doubt they want to see tidal energy be developed at the expense of our traditional fisheries. It is important that all sides in this conflict find some common ground and continue to seek solutions through dialogue before the province ends up in a lengthy court battle that could create further animosity and cost to the taxpayers of this province. So I'd like to ask the minister, what is she doing to prevent this situation from further escalation and costly litigation?
The Honourable Minister of the Environment.
Thank you, Mr. Speaker. Yes, certainly, I have no issue with talking to these fishermen at any time about their concerns. I know that they have asked for a judicial review of my decision. I think what the member needs to know and what public needs to know is that this has been approved, or the approvals have been done, the research has been done since 2006. So there's a lot of background involved.
Order, please. Time allotted for oral questions put by members to ministers has expired. We'll now move on to opposition business. The House Leader for the official opposition.
Thank you very much, Mr. Speaker. I did circulate around the times for PC Opposition Day. Can you call resolution number 11, please?
We'll now call resolution number 11. The Honourable Member for Pictou East.
Thank you, Mr. Speaker. A federally mandated carbon pricing scheme, or carbon tax, when Nova Scotians have already done so much to reduce greenhouse gas emissions, is further proof that the Ottawa Liberals are taking our province for granted. If you think of the Supreme Court debacle, the fact that our COA minister is from Toronto, and now the Liberals, the Ottawa Liberals, want to impose even more costs on Nova Scotians. Nova Scotians are willing to do their